Music for health? Can such an everyday experience really improve your well-being? You may take music for granted since it is all around you, whether you choose it or not, during call waiting, riding on elevators, and throughout shopping malls. You can listen to music that you enjoy at any time with radio, CDs, an iPod, tablet, or your computer. Although you may recognize that music affects your emotions and mood, can it really help you to feel better? This video will help you answer that question. Hello, I'm Dr. Susan Mandel. As a board-certified music therapist, I develop the music therapy clinical and research services at Lake Health here in Lake County, Ohio. Through our research with patients enrolled in cardiac rehabilitation and diabetes education, we found that participation in music therapy can improve your health, including lowering systolic blood pressure and decreasing stress and anxiety. You are about to witness the potent effect of music therapy as you watch our music therapists in action. Russell, who is recovering in the hospital from emergency surgery to remove his ruptured appendix, is in for a surprise. His nurse asked the music therapist to help Russell with pain management. Ellen is about to come to his room with her music cart and learn more about his needs and preferences.
Your nurse said that you were feeling a bit uncomfortable this morning, so she asked me to come in. So if that's okay, I can close the door and we can get started.
Oh, okay.
What kind of music do you like, Russell?
Oh, well, I'm a fan of the Beatles and Creedence Clearwater Revival.
Great. I'd like to use the music that you prefer and involve that in what we do. So I'm gonna pull out my guitar, get that ready, and just want to ask you a few quick questions to get us started.
Okay.
So how are you feeling today? How's your morning going for you?
Oh, well, I've got a fair amount of pain, and I'm not used to being in bed for so long, so I feel a little stiff.
Mm-hmm.
You know, I'm just used to moving around more.
Mm-hmm. But how do you feel compared to when you first came in the hospital? How are things progressing since then?
Well, it's generally been sort of a steady improvement.
Okay, that's great to hear. Mm-hmm. And one more question. Where do you hope to be? Where would you like to be instead of here? A lot of people are look forward to home, but where might you want to be?
Sure, I'm looking forward to getting home and kind of going about my normal life.
Okay, great. All right. I took just a few notes. Put your words down on paper. Before I get the music going, Russell, I wanted to let you know some people like to get more involved when they listen. So I'm going to give you a tambourine, and you can place it where you feel comfortable. And if you want to play, tap along to the rhythm, you can do that. If not, you can just listen. But you can do what you feel comfortable with.
Watch Russell's reaction as Ellen takes his own words and transforms them into lyrics to a song by his favorite singing group, Creedence Clearwater Revival. Then you will hear how Russell relates to a familiar song by the Beatles. Notice how Russell responds to a question about his level of pain after his music therapy experience.
So let's get some music rolling here. You said you liked CCR. So I'm going to take some of what you shared with me and put it to one of their well-known melodies, okay? I'm Russell, you're a songwriter.
Oh, did you just make that up right on the spot?
I took the answers that you gave me to the questions that I asked and worked it right into a song. So this is your words put to music.
Oh, wow.
Yeah, and I also saw you were playing along.
Oh, yeah, I was just tapping a little.
Well, even some tapping is good for you. So that's great. Well, you said that you like Beatles music.
Yeah.
So what if we pull out some Beatles and keep some of the music rolling?
Okay.
Okay. All right. Try to see it my way. Do I have to keep on talking till I can't go on? While you see it your way, run the risk of knowing that our love may soon be gone. We can work it out. 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 So when you get home, Russell, what are some ways that you'll be able to work things out? So you're coping with recovery and getting back to normal life.
Well, I think I'll have to get in some rest, but I think I'll work it out.
How would you rate your pain now? 0 being no pain and 10 being the most.
Oh, I guess I would say about a 4.
That's great. Remember when I asked you at the beginning of our visit, you said you were at a 7. So now you've come down to a 4. So you look much more comfortable too. So
Well, thank you. I am feeling a little better.
great.
I asked Russell about his inpatient music therapy experience when he returned for a follow-up visit with his doctor 6 weeks after surgery. Listen to what he had to say.
I felt that the music therapy experience really brought back a lot of memories and really it took me out of the situation I was in at the hospital. Well, it was a very stressful time. It wasn't the best of days, and I was going through a lot of pain, and it was wonderful to have this very pleasant surprise. The music therapy experience really brought back a lot of memories and took my mind off my pain for a while, and really took me into a very different sort of frame of mind.
Following a recent hospitalization related to respiratory distress from chronic obstructive pulmonary disease, Barbara requested to meet again with Bonnie for outpatient music therapy. Observe how Bonnie blends music with the patient's preferred sounds of nature to help her to relax, soothe anxiety, and learn to regulate her breathing. Watch for changes in her face, hands, and breathing as she listens and gives herself permission to relax.
Hello, Barbara. How are you today?
Good. How are you?
I'm good. Thanks for asking.
Good.
So, how have things been going?
Well, in general, my breathing's been doing a lot better.
That's
so I've been
good.
feeling good.
Good.
The only thing that I notice that's concerning me is that when I get like anxious or nervous, it seems like my breathing is difficult. Like for example, last week, the school called me and told me that my son fell in the playground.
Oh my goodness, is he okay?
He's good. He's good.
Oh my goodness.
It was just a little scrape, so
Yeah.
he ended up being okay. It's just that immediately after I hung up the phone, I noticed that I was having trouble catching my breath.
Sure, absolutely. And that's actually why we're here today, to
Okay.
address some of those anxieties that you might get in just everyday life when those things come your way, those circumstances circumstances.
Okay.
So let me ask you first, how do you feel your anxiety is right now? Maybe on a scale of 0 with no worries to a scale of 10 with intense worries.
I would say probably about a 5.
So right in the middle there. Okay. Well, we definitely want to address that today with some music.
Okay.
I'm actually going to create a music relaxation experience for you today, and we're going to create it on the spot using your music preferences.
Oh, wow.
That,
Okay.
yeah, so we can address your anxiety, which is related very strongly to your breathing. The two are tied. So if we can decrease your anxiety, we might also be able to regulate your breathing too.
Okay.
So what I want to ask you is, what are some of your music preferences?
I like jazz and
Okay.
things like that.
Okay, so something maybe more smooth. Okay, well, we will springboard off of that preference, and instead of using lyrics with the music, we're actually going to substitute some nature sounds. So as you can see on the screen here, we have different sounds like the ocean, birds, rainstorms. What's something you would prefer?
I think ocean sounds nice.
Oh, great. Okay. Right when we start the music, as soon as it begins, I want you to close your eyes as you feel comfortable and just allow the music to take you to a nice relaxing place, okay? Use that ocean as a signal. Take a couple deep breaths. Release all the tension. Relax your hands and your arms. Take the music in. You can open your eyes.
Wow, that was fantastic.
Yeah, you look so relaxed. How do you feel?
I feel wonderful. I mean, it's like a meditative state. I feel
Good.
really, really good.
Good. And where's that anxiety? Rate again for me. 0 to 10.
At most, it's a 3.
Wow.
I feel like it's gone down significantly since.
Wonderful. And what about the music did you really enjoy?
I really enjoyed the way you incorporated your playing with the waves. They felt like, you know, it was very harmonious.
Good, good.
Yeah.
Now, I wonder, are there other nature sounds that you really gravitate to or that are soothing to you?
I really like the sound of rain.
Rain?
That's very
Excellent.
soothing.
Let's create a second experience to allow you to continue to experience the relaxation.
Nice.
Okay?
Mm-hmm.
Okay. Take those couple deep breaths.
I love that. I think that was my favorite.
Out of the two, out of the two. And where's your anxiety now? 0 to 10.
Maybe a 1.
Wonderful, wonderful.
That was very relaxing.
Good, good. I'm so glad. And I'm glad we were able to follow up after your hospitalization, now here in outpatient.
To extend the benefit of Barbara's music therapy session, Bonnie gave her a pre-recorded music-assisted relaxation and imagery compact disc, Harmony of Mind and Body, a Mari Experience, for home listening. I recorded this CD with Daniel Kobiaka, a gifted composer and musician, and studied patients' responses to listening. Research findings suggest that patients who listen to the CD and prefer the music and the sound of my voice may experience improvement in their stress, anxiety, and systolic blood pressure.
Remember that CD I gave you? Actually, is this CD?
Oh, I do. I remember that.
Yes. So what I want you to do when you're at home is to create the experience for yourself by listening to the music relaxation. And I recommend listening to it every day.
Okay.
So when those anxious moments come up where you feel like your breathing and anxiety is getting to a level that you can't control, I want you to pull out your CD and use it as an opportunity to slow the breathing down, regulate the breathing, and help with the anxiety, much like it did today. We went from a 5 to a 1.
Right.
So simply listening to that music can help you with regulating your anxiety in the future.
Fantastic.
Okay? Great. Thanks so much, Barbara.
Thank you.
Good to see you again.
Thank you so much.
You're welcome.
I asked Barbara about her music therapy experience immediately after her outpatient session with Bonnie. Pay attention not only to her voice, but to her facial expressions.
I heard of music therapy before, but I never actually experienced it. And it was amazing. I just, it was so relaxing and I really enjoyed it. And I really can't wait to try it at home. I really felt the effects of it. It was incredible, it was amazing. It was something that felt personal. So I didn't feel so much like I was listening to something, I felt like I was experiencing something. It was a phenomenal experience, and I'd love to continue to experience that and continue to experience the effects of it.
Thank you for taking time to watch this video and learn more about music therapy. As Russell and Barbara will attest, the best way to understand the benefit of music therapy is to experience it. I hope that you will access this integrative medical service offered here at Lake Health. I wish you well.